You've probably heard that the years right before Medicare, ages 62, 63, 64, are the golden window for Roth conversions. Low income, low bracket, convert now and never pay taxes on that money again. And honestly, that idea isn't wrong. But there's a trap sitting right in the middle of that window that I almost never hear anyone talk about. And in 2026, it got significantly more dangerous. According to CMS marketplace data cited by ASTO, 92% of the 24.3 million Americans enrolled in ACA marketplace plans received enhanced premium tax credits in 2025. Those enhanced credits expired on December 31st, 2025. Gone. And a brand new rule that took effect January 1st, 2026, no repayment cap on excess credits, means if you convert too much this year and lose your subsidy, you pay back every single dollar. Not a portion, all of it. What you're about to learn is exactly where that trap is, why it catches smart people off guard, and how to convert without stepping into it. Let's start with why Roth conversions feel like a free lunch during these years, because that intuition comes from a real place. You've retired early or gone part-time, your W-2 income is low or zero. Your traditional IRA or 401k is sitting there and you're not drawing from it yet. Every dollar you convert in a lower bracket now is a dollar you'll never pay ordinary income tax on again. If you're in the 12% bracket at 63, converting beats paying 22% at 70 when Social Security and RMDs are both running. That math is solid. The problem is, what else is happening during those same years? You're 62, 63, or 64. Medicare doesn't start until 65, so you're buying health insurance in the ACA marketplace, and depending on your income, you might be receiving a substantial premium tax credit, a subsidy that offsets your monthly premium. For a lot of pre-Medicare retirees I've talked with, that subsidy is worth $8,000, $10,000, $12,000 a year or more. It's not nothing. It's often the single largest number in their annual retirement budget. Here's what most people don't realize. When you do a Roth conversion, the IRS doesn't treat that money as something separate from your regular income. The taxable amount of the conversion flows directly into your adjusted gross income, your AGI. And under IRC Section 36B, which is the statute that governs premium tax credits, your ACA eligibility income, your ACA MAGI, is your AGI. Plus a small set of add-backs, tax-exempt interest, foreign earned income, and non-taxable Social Security. That's it. There is no special treatment for Roth conversions, no carve-out. The IRS explicitly lists income from converting a traditional IRA to a Roth IRA as income that increases your ACA MAGI, dollar for dollar. Every dollar you convert at the brokerage becomes a dollar the ACA counts as income when it's deciding whether you get a subsidy. Now let's talk about where the cliff actually is in 2026, because the numbers changed at the end of 2025 and they matter enormously. The enhanced premium tax credits that Congress passed in 2021 under ARPA and then extended through the Inflation Reduction Act, those expired December 31st, 2025. Under the enhanced rules, the subsidy was available at any income level, though it phased down. Starting January 1st, 2026, we're back to the original statutory structure. The ACA's premium tax credit is only available to households between 100% and 400% of the federal poverty level. Above 400% FPL, zero subsidy, not a reduced subsidy. Zero. Based on the 2025 HHS poverty guidelines, which set the thresholds for 2026 ACA coverage, 400% FPL for a single person in the 48 contiguous states is $62,600. For a two-person household, say a 63-year-old couple, both retired, that ceiling is $84,600. $1 over those numbers, and you're off the subsidy entirely. The Bipartisan Policy Center ran the numbers on what that means in practice for a 60-year-old couple. At 402% of FPL, roughly $85,000 in income, they could pay a yearly premium of $22,600 in 2026. Under the expired enhanced credit rules, that same couple would have paid around $7,225. That's a difference of more than $15,000 per year from one extra dollar of income. Planners who work with the math on this sometimes describe the effective marginal tax rate on that crossing dollar as exceeding 1,000,000%, which sounds absurd, But when you're losing $12,000 to $15,000 in subsidy on a single additional dollar of income, the math actually gets there. I know that sounds like hyperbole. Run the numbers. It isn't. And here's the part that got worse this year. Prior to 2026, if you enrolled in advanced premium tax credits throughout the year, meaning your insurer got paid by the government on your behalf each month, and then at tax time, your actual income came in above 400% FPL, the law used to cap how much you had to repay based on your income. For a household at 200% to 300% FPL, the old repayment cap was around $1,525 for a single filer. You were protected from paying back the full year's credits. That cap is gone. Under PL 19921, the 2025 reconciliation law, the statutory repayment cap has been eliminated for tax years after 2025. The IRS confirmed this in its Q&A on the premium tax credit, Q&A 31 specifically. If you receive advance credits all year and then do a December Roth conversion that pushes you $5,000 over the cliff, you owe back 100% of every dollar the government paid your insurer on your behalf. That could be $10,000, $15,000, $20,000 added directly to your April tax bill. No cap, no cushion. There's actually a second cliff that I want to spend a minute on because most people, and honestly, a lot of advisors, skip past it entirely. It sits at 250% of the federal poverty level. For 2026, that's $39,125 for a single filer and $66,625 for a family of three. Below 250% FPL, if you're enrolled in a silver plan on the ACA marketplace, you qualify for something called cost-sharing reductions, CSRs. These aren't just about your monthly premium. CSRs reduce your deductible, your copays, your out-of-pocket maximum. On an enhanced silver plan at 200% FPL, your deductible might be $500. Without CSRs, that same silver plan might carry a $4,500 deductible. Your out-of-pocket maximum could jump from $2,000 to $7,000 or more. The Congressional Research Service detailed the CSR structure in Report R44425. If you're a 62-year-old single filer with $35,000 in Social Security and other income, so just under 250% FPL, and you decide to do a $10,000 Roth conversion, you've just crossed that CSR cliff before you're anywhere near the 400% cliff. You haven't lost your premium tax credit yet, but you've lost thousands of dollars in real healthcare value. The deductible goes up, the copays go up, and you won't see it until you actually use your insurance and realize the math changed. The right move, if you're anywhere near 250% FPL, is to calculate exactly where you sit before you convert a single dollar. Don't assume the only line that matters is 400%. So let's talk about what you can actually do. I research retirement strategy for a living, and when I look at the toolkit available to a 62 to 64-year-old on an ACA marketplace plan, it's narrower than most people expect, but it does exist. The first lever is pre-tax 401k contributions if you're still working, even part-time. For 2026, the employee deferral limit is $24,500 with an $8,000 catch-up at age 50 plus. If you are between 60 and 63 specifically, there's a super catch-up at $11,250 instead of $8,000. That's a secure 2.0 provision. Every dollar you defer pre-tax comes directly out of your AGI, and therefore out of your ACA MAGI. If you're earning $40,000 part-time at 62, maxing that super catch-up contribution drops your ACA MAGI by $35,750. That creates real Roth conversion headroom. The second lever is HSA contributions. Now, here's something that changed this year. Under PL 19921, the 2025 reconciliation law, all bronze tier and catastrophic marketplace plans are now automatically HSA eligible in 2026. That's new. Before 2026, you had to carefully check whether your specific bronze plan was HSA qualified. Now it's automatic for that tier. For 2026, the HSA limit is $4,400 for self-only coverage, $8,750 for family, plus a $1,000 catch-up if you're 55 or older. HSA contributions are above-the-line deductions. They reduce your ACA MAGI directly. If you and your spouse are both 60, a family HSA contribution of $9,750 is real money working in your favor. What doesn't work, and I want to be clear about this because it comes up constantly, traditional IRA deductions. The idea is you convert from your IRA to Roth, and then you contribute back to a traditional IRA to offset the conversion and reduce MAGI. The problem is that if you're not working, no earned income, you can't make a deductible IRA contribution at all, period. The IRS requires earned income equal to or greater than the contribution amount. If you're fully retired at 63 and living on savings, that lever doesn't exist for you. Here's how I'd actually approach sizing a Roth conversion in this window if I were sitting across the table from a 63-year-old on an ACA Silver plan. First, pull your projected ACA MAGI for the year before you touch anything. That means Social Security income, including the non-taxable portion, which the ACA adds back, investment income, any pension, any part-time earnings. Know that number exactly. Second, identify your hard ceiling. If you're single, that's $62,600. If you're a couple, $84,600. If you're anywhere near the 250% FPL line for CSRs, calculate that ceiling too, because losing CSRs can cost you more in practice than the tax savings on a small conversion. Third, calculate your conversion headroom. The gap between your projected MAGI and your hard ceiling is your safe conversion zone, with a buffer. My take is you want at least a $2,000 to $3,000 cushion below the cliff, not a $50 cushion, one unexpected capital gains distribution from a mutual fund at year-end and you're over the line. Fourth, consider the timing. Roth conversions are completed when you execute them, not on December 31st. But your income picture is clearest late in the year. A lot of planners do a preliminary conversion in October, then finalize with a small top-up or hold off entirely in November once they can see the full year's income. That's not a bad approach, though your filing status and the composition of your other income changes the math, so work with a tax professional on the specific sizing. And if you're on a bronze plan in 2026, you're now automatically HSA eligible. Fund that account before you convert. The $4,400 or $9,750 you contribute to the HSA comes off your MAGI first, and it expands your safe conversion window by that exact amount. The broader point I keep coming back to, the Roth conversion window at 62 to 64 is real and valuable. But in 2026, with the subsidy cliff reinstated, rates projected to rise roughly 18% according to the Bipartisan Policy Center, and the repayment cap removed, this is the year where an unconsidered conversion doesn't just cost you a little. It can cost you $10,000 to $20,000 in a single tax filing. The math has always punished crossing that line. In 2026, it punishes it more than it has in years. I'm not a licensed financial advisor. This is general education, not personalized advice. Consult a fiduciary before acting. If this was useful, subscribe. There's more of this kind of kitchen table math coming every week. And if you've got a specific Roth, Social Security, or tax question you'd like me to dig into next, leave it in the comments. I read them, and I'll work the good ones into upcoming videos. Next week, I'm getting into the Social Security delay question, specifically the 24% delayed retirement credit versus what the real break-even looks like for your situation, not the average. That math is almost never done correctly, and I want to show you how to actually run it for your own numbers. This video may contain affiliate links. I only recommend tools I use personally.